Hi, everyone. Welcome to the Gut Reset Summit. I'm your host, Dr. John Dempster, and today I'm thrilled to be joined by Dr. Michael Ruscio. And Dr. Ruscio is a leading functional and integrative provider specializing in gut-related disorders such as SIBO, leaky gut, celiac, IBS, and in many different thyroid disorders as well. He is a clinical researcher and best-selling author whose practical ideas on healing chronic illness have made him an influential voice in the functional and alternative health space. And his work has been published in peer-reviewed medical journals, and he speaks at integrative medical conferences across the globe. And Dr. Ruscio also runs an influential website and podcast with the goal of spreading his vision of practical and very scientifically grounded functional healthcare. Dr. Ruscio, great to have you on the Gut Reset Summit.
Boy, that bio makes me sound a lot smarter than I feel.
Hey, I've been following your work for a long time. That bio doesn't do you any justice. So
thanks.
You're doing great things out there. And today we're going to dive into a very, very important topic. We're going to really try to connect two very seemingly different organs in our body, the gut and the thyroid, and really start to figure out what's going on here. Can you give us a high level of how these organs or these systems are even connected?
Yeah, I mean, the high level is two or threefold in terms of how they connect. Underappreciated regarding the gut is this is where the largest density of immune cells in your entire body is, specifically in your small intestine. And if we appreciate that the most common cause of hypothyroid is actually autoimmunity, then we see how important the implication of the immune system tie-in through the small intestine is. Along with that, inflammation can be the cause of a lot of symptoms that we think are mold or metals or adrenals or thyroid. Sometimes it's far more benign than that. It's just inflammation. And, we tend to go to the more exotic diagnoses, especially if we type stuff into Google. But sometimes just real simple inflammation is the reason why you have a hard time thinking or a hard time sleeping or whatever it is. And then the other, which is perhaps the most pernicious and has really come to light in research over the past 5 years or so, is that if someone is truly hypothyroid and they're on medication, it has to be absorbed. Just because you swallow a pill of levothyroxine or Synthroid or desiccated thyroid hormone doesn't mean it gets absorbed consistently. And in some patients who are struggling with, my TSH, it's normal, then it's high, and then it's low, and then it's normal, it's high, it's low. This could be due to inconsistent absorption. So really through the intestinal impact on inflammation and immune function and also absorption of hormone, this is the main few ways in which they tie together.
Yeah, absolutely. Now, let's maybe break it down for a second here. What are we going to talk about from a thyroid perspective? We've got hypo usually, we've got even hyper cases. What are some of the signs and symptoms of both? And, some people who are listening right now, this might even be new to them. They might even be suffering without even knowing that they have an issue. What should they be looking out for?
Well, so like with many things, there's a lot of overlap between the symptoms, right? So some of the hallmark symptoms are fatigue and dry skin, also feeling cold, perhaps brain fog and low mood. Also, there could be constipation present. That's probably the short and most common list. Weight gain to some extent, although that's not always the case. And these are all with hypothyroid, meaning low thyroid function. Conversely, if you invert most of those symptoms, you'll have the symptom list for hyper or high thyroid function. Instead of being tired, someone might feel kind of wound up and anxious and be having palpitations and not be able to sleep, and feeling hot and having thinning hair. And kind of oily skin, and they might be sort of sweaty. So it's really sort of, as we turn the metabolic dial down or up, that's the way the symptoms can manifest. And this ties ultimately back to the fact that the cellular thyroid receptor dictates the metabolic rate of that cell. And so we want to make sure we have sort of this sweet spot, not too much, not too little. And when we don't, that's how we see these various symptoms manifest.
So you've recently, you've been doing a lot of work and research for a long time, but you've recently published 2 papers in 2022 and really starting to, again, draw a bit more of a gut-focused approach to thyroid care. And what I'm going to be fascinated about today is is this a chicken or an egg thing? A lot of the thyroid issues come from the gut, but a lot of different gut issues can also, and this is why I want to hear from you, do you see the thyroid causing a lot of gut issues when the thyroid's out of balance?
Yeah, great question. In my observation, this tends to run more from the gut to the thyroid. And not only have I seen that clinically, but if you look at the stats, so if we take IBS, up to 15% of the population has irritable bowel syndrome. So gas, bloating, constipation, altered, stool consistency, constipation, diarrhea, this whole sort of assortment. 15%. Hypothyroidism affects about 0.3% of the population. So there's a really big delta. Now, some will say, well, actually, it's higher than that. It's closer to 5% regarding the prevalence of hypothyroid. And this is a really important distinction. If we include what's known as subclinical hypothyroid, that does include 5% of the population. And this does matter. Sorry to get really into the nerdy details here, but if we don't understand the stats, then maybe well-intentioned messaging by a healthcare provider, but nevertheless sloppy data leads people down the wrong diagnostic path. Okay, so 5% if we include subclinical plus true hypothyroid. Why does that matter? Subclinical hypothyroid is when there's only a mild elevation or a mild skewing of your thyroid values. This is oftentimes called sluggish thyroid. But here's the thing. We know that 75-ish% of those people with time will go right back to normal if they do nothing. So it tends to just be a transient, innocuous issue. Further yet still, we've run experiments, and by we, I mean the scientific community, many a time in clinical trials where these people with sluggish thyroid are given thyroid hormone, their symptoms do not change. So it really matters when we distinguish between the fact that about 0.3% of people have true hypothyroid and about 4% of the population has sluggish or subclinical hypothyroid. But then zooming way back out into the broader context, true hypothyroid, 0.3%, IBS, 15%. So just looking at the stats, it's much more common to have a gut issue than a thyroid issue. And since we know either one of these can cause fatigue or brain fog or constipation or maybe low mood, it just makes much more sense to start your investigation with someone's gut health, unless they have clear blood work documenting that they're overtly hypothyroid. But for a lot of people, they're probably trying to figure out, well, where do I sort of examine first? Because we can't tackle everything at the same time. So when in doubt, I would say start with the gut.
So this is great. What are we looking for in the gut? Are there certain markers? Are there certain tests or signs that you're looking for?
I oftentimes find myself in this semi sort of contrarian position because I don't necessarily agree with a lot of the nostrums in the party, if you will, of functional alternative medicine. So I used to do a lot of stool testing, and I'll just lead by saying I really would discourage people from thinking that testing is going to reveal the cause of their chronic constipation, diarrhea, bloating, abdominal pain. Different than my gastroenterologist seems concerned. He wants me to do X, Y, or Z test. I'm not talking about conventional medicine. I'm talking about, you go into this other realm of integrative care. It might be a conventional doctor, but they're operating in a more integrative model, trying to resolve where the chronic low-level symptoms are coming from. This is when the game changes, and wherein I do not see the utility of testing. Now, some quick backstory, I got into this because I had a parasite in college. I had a true parasite, an amoeba histolytica, that will kill people in third world countries because it causes such bad diarrhea, they dehydrate and they die. So if anyone's empathetic to testing, it was me, because I had a stool test that revealed a parasite. And so because of this, for the first 5+ years in my practice, I did 2 stool tests on every individual. And so that's, if you factor in 4 new patients a week, I'm seeing patients, or I was then 2 days per week, Over that time period, it's 2,000 stool tests. So I've looked at well over 2,000 stool tests, and I can tell you that they rarely match. In fact, we'll be releasing a podcast where I just outline, we took one patient's stool, we split test to two different labs, and the results were vastly different. C. diff on one test, no C. diff on the other test, candida on the one test, no candida on the other test. So because of this, because of the inconsistency with the testing, we really can't look at the testing as a way to tell us what to do. You will find something positive, right? But then the question is that accurate and is it actionable? So rather instead, I would just take stock of your symptoms. If you have any GI symptoms or any non-GI symptoms like brain fog, and you can't figure out where it's coming from, I would just run a few simple therapeutic trials on yourself. And these are simple things you can do at home. And we can go through the short list in a second if you want. And what you're looking for is, okay, I'm going to try this experiment. And if it's the right thing, if I'm in the right ballpark, gut, I'm going to see my symptoms budge within 2 or 3 weeks. And if so, we're going to keep going. It's really as simple as that. Again, with the caveat of, if you have bloody diarrhea, if it's acute and severe, this is more conventional medical intervention. You want to go see your GP or your GI. But when we get to chronic low-level annoying symptoms, this is where the testing utility really breaks down.
Well, that's fascinating, because I'm sure a lot of people listening right now who've worked with functional doc probably have had some exposure, especially if they've had chronic gut issues, to some of the tests that are available out there. But this is why we have to keep looking at the data, and we have to keep analyzing and being very scrutinizing. And, who knows, maybe there'll be down the road, there'll be better tools and better analytics. But for now, that's very, very interesting. Thank you for sharing. So again, you're looking at signs, you're looking at symptoms. I guess the next question is what do we do? What do you find are some of the best therapeutic aids, whether that be diet, lifestyle, even supplementation, to start to correct the gut issues that are linked to the thyroid condition in the first place?
Well, the one, especially for audiences that are sort of privy to healthcare, can be a low FODMAP diet. And the reason for this, is because oftentimes when someone goes to improve their food quality, they're going to eat more fruits, more vegetables, more fiber, which can be good, right? But for someone that has gut health that's currently impaired, or their system gastrointestinally might be a tad sensitive, that sort of dietary shift can flare some of those people. It will help some. I'm not trying to say, oh my God, everyone has to go low FODMAP all the time, because we have to be careful about that with dietary conversations, because it leads to dietary neuroticism. And at the clinic, we see a lot of this. But people will sometimes notice or say something like, man, the better I eat, the worse I feel. So if you're someone who's noticed that, or if you've improved your diet quality and you're not feeling like you're getting any better, maybe even feeling a little worse, it could be that there's just too much fiber and too much prebiotic, the compounds that feed bacteria, different than a probiotic. Prebiotic feed the bugs, probiotics are the bugs. But a low FODMAP diet is designed to reduce levels of these foods, which many are synonymous with healthy foods: broccoli, cabbage, cauliflower, avocado. And again, it's not to say that they're unhealthy, but for a short term, reducing those can help balance the levels of bacteria in the gut, and therefore reduce gas and pressure and loose stools, constipation, pain, even reflux. So that would be one thing for people to consider, is a therapeutic trial on a low FODMAP diet. And if it's the right fit, within 2-3 weeks, you're going to see symptoms shift.
And I think, that's really important. You don't want to be doing this for long term. A low FODMAP diet probably shouldn't be a long-term play. It should be a short-term.
Exactly. Yeah.
Right?
And most people will notice that after a term, they can bring these foods back in. The way I describe this at the clinic is, because people ask, well, is this forever? Understandable question. And my reply will often be, well, if you sprained your ankle and your PT or whoever said, take some time off of activity, off of the ankle, you wouldn't say, well, is this a forever plan for rehabbing my ankle? You'd understand that no, for a short term, you allow healing, and then you can start walking, then you can start jogging, then you can start running, sort of in this, phased approach. Same thing with FODMAPs. And usually 1 to 2, maybe 3 months, and then people can really introduce with a lot of success.
You mentioned earlier, about probiotics and of course prebiotics as well. But probiotics, I believe, and I love your input on this, they've shown to really help people who have thyroid conditions who also might be on medication really improve the efficacy of that meds. Is that correct?
Yeah. So, the data here are mixed. So I should be careful to disclose that. But there are some trials that have documented improvements in TSH levels for those who are on thyroid medication when supplementing with a probiotic. And when we tie that observation to other data that have found if you have H. pylori, this bacterium that can infect the stomach, and you treat that, you can improve your thyroid hormone absorption. If you have an ulcer and you treat that, you can also improve absorption. I think we can somewhat safely say that to the degree to which there's some sort of imbalance in the GI tract, those who then supplement with probiotics and improve that imbalance may see improved absorption of their thyroid hormone medication.
Is there a certain type, strain, dose of probiotic that we should generally consider?
Yeah.
You and I, Dr. Ruscio, we both know there are hundreds, if not thousands, of different supplements out there that are claiming to be high quality probiotics.
Yeah. And a lot of them, probably most of them, within reason, are. Now, apply some basic logic. If you see most probiotics are, let's just arbitrarily say $50 for a bottle, and then you see one that's $17, that could be cost cutting. Also, the other thing here, and we reviewed this in one of our recent videos, it was actually insightful for me because it didn't really even hit me until we did this cost analysis. What some of these companies will do, knowing that people will buy if the price tag is lower, is they will just reduce the amount of servings in a bottle.
Mm-hmm.
So it's $17, but you get 10 servings. The $50 one, you get 200 servings. And that was actually the breakdown where if you did the math, and we reviewed a probiotic protocol for constipation, what was done in the research study, it was a 3-month intervention. So you'd need a few bottles, right? If you bought the cheaper price tag probiotic, it was actually 2 or 3 times the total cost to do the 3-month intervention because the cost per serving was much higher, but there was fewer servings in a bottle, so the bottle price was lower. But anyways, not getting too far afield. There's a lot of good quality probiotics out there. I think the thing that's challenging for consumers is all of the probiotic manufacturers are, they're all trying to tell you why their probiotic is good. But the problem with that is then the marketplace is just flooded with all these competing claims. Mm-hmm. And what I've tried to do is take more of, truly a meta, kind of like a meta-analysis or a high-level view. And when you look across multiple trials, you see there's no magic formula. And even in some studies, researchers will take 2 different formulas, give half the subjects one, half the subjects the other, and they've documented similar efficacy. So what that tells me is there's not a magic probiotic, but rather you want to think about probiotics, at least the way we do, with this heuristic that organizes them by type. There's your sort of human-based traditional lactobacillus and bifidobacterium blends. And if you look on the label, you'll see a number of different organisms that are either lactobacillus or bifidobacterium. So that's the one type. The other is actually a fungus. This is Saccharomyces boulardii, discovered by Henry Boulard in the 1920s. And it'll just say on the back, Saccharomyces boulardii. And the third type is a soil-based probiotic. And this typically has some type of bacillus species. And these have all been shown to be beneficial for a wide array of conditions at a wide array of doses. So it's like such good news in terms of it doesn't have to be that complicated. The one thing that I think eludes people is this approach that we call triple therapy. So picture in front of you 3 different bottles. These are the 3 different types. people will often try one or try the other, see some results, and then stop and say, well, it helped a little bit, but didn't resolve everything. I wasn't sure what to do, so I stopped. A couple of things in reply to that situation. Some evidence now is showing that the peak level of improvement with probiotic supplementation may not be achieved until the second or third month of use. So it's important to keep that in mind. You should notice some improvement in my observation within the first roughly month, but you may need to continue to the second or third month to hit the pinnacle level of improvements. The other, and this is our observation, and we're working to publish on this, but if one probiotic formula is helpful, then what if we combined all three? And this is what we've been doing in the clinic. So we'll essentially give people the 3 different bottles and say, take 2 capsules from each bottle. It's pretty, it'll get you in the ballpark, because for many of the studies, they've used anywhere from, let's say, 1 billion CFU up to 10. So again, there's not a magic dose. Good news. And so now you take 2 capsules from each bottle, and that's your dose. And you can do that once or twice per day. And this seems to be able to get more effectiveness out of the probiotics. And this is also something that conventional medicine has been doing for a while. They'll combine more than one antibiotic, bringing back in H. pylori or even SIBO. Double antibiotic therapy has been shown, loosely stated, to be more effective than single antibiotic therapy. So it's a similar concept that we're just applying to probiotics. And I'd much rather someone go robust on their probiotics and not need to use something like an antibiotic or even an herbal antimicrobial. So said simply, those are the 3 different types. As long as you're not buying a junk probiotic that's the cheapest one on the shelf and they follow what's known as GMP, good manufacturing practices, then essentially you're looking at taking 2 capsules. And if you really want to have the robust protocol, take 2 capsules from each of those types and give yourself about 3 months to assess where the pinnacle of response may be hit.
That's amazing. Yeah, thank you for that. Now, I guess, another question I have in lieu of that is we hear a lot about fermented foods and probiotic cultures coming from these foods. Does that ever replace the need of a probiotic? Do you do it simultaneously? Do you choose not to do these at all because of other issues that could happen with these types of foods?
Yeah, this is a great question. Both, right? I think fermented foods are an important thing to integrate into one's diet in habitual fashion. So I would certainly consider a wide array of whether it's fermented milk products like kefir or sauerkraut, kimchi, kombucha. Some people can be a little bit sensitive to the histamine in these types of foods. This is more of a rarity and it's getting a little bit into the weeds. But if you have noticed, if you're someone watching this, when you eat a lot of fermented foods, you feel a little bit foggy or maybe you feel flush. This might mean it's a little bit too much histamine for your system, which is one of the metabolic byproducts of the fermentation process. But generally speaking, that's not going to be an issue for most people. And people should be integrating these into their diet. And there are some studies that have documented that fermented foods are helpful for IBS or whatever it may be. To some extent, and for some people, there may not be a sufficient dose with the probiotic foods alone. Most probiotic foods, you're looking at anywhere from 1/4 to 1/8 of the probiotic content of 1 capsule of a probiotic supplement. Now, more doesn't always mean better, but if someone's used fermented foods, they've seen some response, but not full, that's when they may want to complement that and supplement on top of that, at least for a short term, with a supplemental probiotic and see if that gets them even more benefit.
Well, we've always got the sauerkraut at the table at home, and I've got young kids. We put it on everything. So
love it. Love it.
We're big fans. You touched on a topic earlier that was really important that I want to explore, and that's the conversation of SIBO. And, now that bringing this back to the thyroid here, we find, and I want to hear from you, what's the impact of thyroid medications and the connection to SIBO?
So there was one study maybe 5 years ago that found that people who are on levothyroxine had higher levels of SIBO than those who weren't. And it was, I think, a little bit misinterpreted by sort of the media, because correlation does not mean causation.
Mhm.
So the way I would interpret this is in people who have hypothyroidism, they are more likely to have low stomach acid. Maybe 30-40% of people with hypothyroid could have low stomach acid. And that can open the door to allowing SIBO to occur. So it's more likely just a correlation with the medication, but not that the medication is causing the problem, but just people who have hypothyroidism, lower prevalence of low HCl, or I'm sorry, a higher prevalence of low HCl, that can allow SIBO to occur. So it's something to be aware of. And I think part of the reason why it's so important for someone who is hypothyroid and maybe still struggling with some symptoms to give their gut health a look, because it's possible that they have SIBO, and turning their focus to treating their gut is what may help their non-responsive constipation, dry skin, fatigue because of the SIBO. And just be careful not to think, well, I've got to really dial in the ratios of my T4 to my T3, because we see so many people who just get, and this is one of the things that we published on last year, they just get pulled into the weeds of really trying to kind of micromanage their lab values. And that's maybe just a clinical principle that's really important. For most things, there's probably some exceptions out there, but micromanaging lab values is almost for sure going to end unsuccessfully. It's just not how most things work. We want to get you in a ballpark, but then from there, we're not robots, right? There's going to be variation within a day, from day to day. And so it makes it kind of moot trying to force levels into these narrow ranges.
I want to touch on that some more, but I just wanted to circle back to the SIBO conversation. I'm really glad you opened that conversation, because I think traditionally we often associated SIBO just with bloating, constipation, diarrhea, gut stuff.
Right.
Now we're seeing that there's connections to all these other possible scenarios in our body, including thyroid disorders. So I think that's important to underline that.
Yeah, no, fully agreed. And this is why, just as a quick aside, I like thinking about these things in rank order probability lists, in terms of, okay, you could have a thyroid problem, you could have a gut problem. Let's put these in rank order from what is most common in the population, gut dysfunction, then to less common, thyroid dysfunction.
Yeah.
This helps healthcare providers and patients try to have a plan, because I think one of the things that, and I include myself in this, when I haven't been feeling well, what is it, right? Is it X, Y, Z, A, B, C? And so having a rank ordered list helps you to prioritize and execute and not feel overwhelmed by all these possibilities, or like you're doing a bunch of tests and a bunch of therapy and you don't know what's going on and you can't make heads or tails.
So let's get back into that. I appreciate that. Let's get back into the thyroid, like not chasing the markers so much. Now, that being said, are there certain markers that you still see as being valid from a, whether it's a blood test, the standard tests we've all heard of, but are there markers that are more valid or less valid?
Yeah, the TSH and the free T4. And, just to contextualize this, there are some that really think that the T3 is important to look at, and whether it be T3 or free T3 or reverse T3, these are really telling you what sort of metabolic or other stress the body is under. Are you underslept? Is there a lot of psychological stress? Are you too low calorie? Are you too low carb? These will all perturb conversion of T4 into T3, but this is not a thyroid mediated function. So it's just crucially important for people not to say, well, my TSH and T4 were normal, but T3 was low, so my provider started me on Armour. That is a bad thing to do. Well-intentioned, and this is some of the sort of earlier hypothesis, but what I see more often, again, pardon me if I'm getting a little bit into the weeds here, but someone suspects they have a thyroid problem. They read about how gluten and grains are bad for the thyroid. They change their diet, they go low carb, and they might even be going too low calorie because they've gone too far in terms of overcorrecting their diet quality. So now they're too low carb, too low calorie. They're not sleeping well. Their hair is thinning and they're having low energy and low mood. And then they go get a blood panel and it's like, oh, look, your T3 is low. We got to put you on thyroid hormone. So now we're forcing hormone into a body that's trying to kind of protect itself and make these metabolic adaptations because you're essentially starving the system. And then we're forcing T3 into that system. So this is why it's important to keep all these things in mind, and why the conversation on diet I mentioned earlier is important to handle with tact and precision. Because if we just make these really sort of broad claims that everyone with a thyroid problem should avoid gluten or grains and or dairy, people can end up in this situation, which I see all too commonly, and then it kind of snowballs. So the T3 is almost always a byproduct of what's happening upstream with someone regarding their stress, their sleep, their diet, their calories, their carbs. So this is why assessing T3 doesn't really have any merit in my mind, but the TSH and the free T4 will tell you about thyroid function. And really important to bear in mind that sluggish thyroid, we've run this experiment, and I want to make sure to arm people with this knowledge. Does sluggish thyroid cause symptoms? Will medication help you if you have sluggish thyroid? Well, researchers have looked at this, and to date, there have been 7 clinical trials that have said, maybe let's experiment. Let's see. Let's take a group of people with sluggish thyroid who have a slight elevation of TSH, a slight lowering of T4. So it's within the normal range. It's just sort of suboptimal. This is the sluggish thyroid. Let's give them hormone and see what happens. And in these 7 clinical trials with over 1,000 patients, they have not found any symptomatic improvement when giving people with sluggish thyroid hormone. So if you had asked me this 5 years ago, I would have said, yeah, these people need hormone because their thyroid is sluggish. It's suboptimal. It's crucially important that with time, right, and research and the true wonder that we have of this scientific evaluation of this principle, we can now say, it was a hypothesis, but it's now been tested, doesn't seem to help. So we've got to stop doing that. And I don't think this has gotten out to everyone, and that's fine, right? These things take a while to sort of permeate into the ecosphere of healthcare and of medicine. But in answer to your question, it's important not to get pulled into the sluggish thyroid interpretation. And you're either frankly hypothyroid, meaning your TSH is quite high and your T4 is low, or you're not. And if you are hypothyroid, according to the TSH and T4, then medication will likely help you, almost for certain. But if you're not, remember that most of those cases will see their levels normalize with time and no other intervention, and they don't benefit from medication. Now, just really quick here, sorry, I'm rambling a little bit, but some people will say, well, I went on hormone and I think it helped me. 2 things in response to that. One, placebo. If you literally give someone a sugar pill, and even if they know it's a sugar pill, there have been documentations of over a 30% positive response rate to placebo. And that's probably going to account for most of these cases. Might there be a rare exception where someone does feel better? Yes, but it's crucially important to understand that thyroid hormones kind of being dispensed like Pez, and we've got to be better about making a case, because we end up seeing the people who've been on this sort of arc of went on hormone, I thought it may have helped, but now I'm 6 months in, I don't think it's helping. I'm actually noticing I'm not sleeping well and I feel fatigued. And thyroid hormone in someone who doesn't need it can actually make their symptoms worse. So it's crucially important not to think, well, let me just take the hormone because maybe it will help. It actually may be harming you to some extent. So unless you have clear lab documentation, and this is one of the areas that the labs are accurate because we have a lot of data to answer this question, then you shouldn't be on hormone. And it's really important to bear that in mind. Check this with your healthcare provider, obviously, but also keep in mind it's your prerogative as a patient to get a second opinion if you feel your healthcare provider might be a little bit brash or too confident, or dogmatic in their thoughts regarding thyroid hormone and thyroid lab interpretation.
Thank you. Now, you made me think of something. You mentioned earlier about the inconsistencies of the stool testing. Do you ever see that with the blood labs for the thyroid as well? Like, can we say, okay, those labs, they're going to be solid each time we measure them, or does it vary in the time of the day, time of the month?
Yeah, so there is variation. Thyroid labs are much more definitive, well-studied. They don't suffer from many of the things that the stool tests suffer from, which is the stool tests are really being used outside of the context they were validated to assist in. Stool tests, and there's a lot of things you can test in the stool, but for the purposes of, you go see a functional health provider, and they're working this sort of integrative wellness healthcare model. They're going to rule out parasites, inflammation, dysbiosis, look at enzyme function, this sort of thing. That's what I'm referring to. And the tests haven't been validated in that context. They've been validated in the context of, I'm presenting with acute gastroenteritis, diarrhea, acute pain, maybe vomiting. We need to know, is this inflammatory bowel disease? Is this a parasite? Or is this IBS? And, if it's the one, it's an antibiotic. If it's the other, it might be an anti-inflammatory. And if it's the other, it's either self-limiting, or maybe we make some dietary changes. We think about stress, what have you. Mm-hmm. So it's helpful in that context, because you don't want to send someone for a colonoscopy who has a parasite, right? But when someone has chronic low-level symptoms, the tests, they don't help you dictate what path to go down. What is being tested for doesn't really change the treatment. Meaning, if someone has dysbiotic bacteria, there's a gazillion things we can do in the natural arsenal that don't require you to have that test result. Improve their diet, it'll improve dysbiosis. Probiotics will improve dysbiosis. Elemental dieting will improve dysbiosis. Curcumin will probably improve dysbiosis, as well as a number of gut symptoms. But not only that, the labs are inconsistent, because they're using different methodologies. They're testing different windows. So for many reasons, the stool testing is something to be avoided. But with thyroid, the methodology is very consistent. There's been study here for a long time with huge numbers of people, and we do see fairly consistent findings and reliability with, if you're found to be hypothyroid, then you'll benefit. And if you're not found to be hypothyroid, you won't. Now, to your point about variability, there is variation. And this is where the cutoffs have been established. And so functional medicine steps in and tries to say, well, conventional medicine, no, you're wrong. Like, your ranges are too broad. Let's narrow them. And that's the hypothesis of sluggish thyroid I mentioned a moment ago. But it's since been tested, and it hasn't been found that those people actually benefit. So even though there is variation, the variation is within limits to wherein we know that as long as you're within a window that we call normal, then there's no need to give hormone. You're not diagnosed positive. Once you go outside that window, even variation, you're still going to benefit. And so hopefully that makes sense. But the one key thing here is really the TSH. So the cutoff for the lab is 4.5. So LabCorp, Quest, all the big box labs, if you go above 4.5, you'll be labeled as positive. However, most people will not need or benefit from medication until their TSH exceeds 10. So that's sort of the sluggish, right? So 4.5, and then you go sluggish when you go above, or some will even say close to 4.5. But remember, many of those people with time will come back to normal. So that's the sort of fluctuation into subclinical or sluggish thyroid. It's not until you get really elevated that there is a need to intervene. So hopefully that's not going too into the weeds, but it's really pretty straightforward. The TSH can go into sluggish territory. It's not until you go above 10 that people will benefit from therapy. And it's a great question, because the variability piece is important. But again, we have that sorted when using that 10 cutoff for TSH.
No, this is not going into the weeds. I think we need to hear this. This is very enlightening. I think one of the dogmas of functional medicine is when you test, you don't guess. And, I think there's merit to that, obviously. But I think, also there's probably been a lot of things that have been overdone. And so, this is where we've got to keep evolving. and improving practice, especially in the functional medicine space, which I believe is part of the integrative approach for the future of healthcare. But we've got to make sure that we stay on the science. Yeah. So this has been
Yeah.
very,
Yep.
very enlightening. Thank you. Now, before we wrap today, are there any other clinical pearls of the gut-thyroid connection that we've alluded in our conversation so far?
Well, I think the one, or I guess two things I'd mention is, to your point, right? If we're not assessing, we're guessing. That was really appealing to me early in my career. And the more I've learned, the more I've come to appreciate that lab companies have really influenced the training in the field and the thinking in the field. And the problem here is all the incentives are aligned in the wrong direction. Lab companies are trying to help. I'm not pointing a finger at them, but there needs to be sort of a tension between lab companies and doctors, right? Like a pull. But right now, the lab companies market to the doctors. Are you not getting good results for your patients? Or do you have patients that you're not sure what to do with? Run the labs. The labs will tell you all the answers. The doctors trying to help patients understand why they can help them are proclaiming, are you not feeling good? Have doctors not been able to help you? We need more advanced lab testing. Patients read this and they go, I want to feel better. I'm not sure why. I need the lab. Right? So everyone is thinking that the labs are going to help them, but no one's kind of saying, hey guys, like, has anyone fact checked the labs? Might this be a spurious promise? And yes, that is the answer. And boy, I can confidently say that the better the clinician is, the less testing they are going to order. I mean, just it's unrefutable at this point in time. Again, there's certain exceptions, but the overwhelming elephant in the room is that we are doing too much testing, and we have to get back to this empirical model. Like, let me listen to you. What are your symptoms? What is your history? What have you done in the past? So fibers flared you in the past. When you eat a lot of histamine food, you get brain foggy, right? These little things that are actually huge flags, huge pearls that you can pull out from just listening to someone and understanding their story. And then that can tell you, well, we should do this, we should do that, or we should avoid this other thing. And this is sort of the art of healthcare that's getting lost, because we're all putting our faith in the labs. And I can say that I have become much better as a clinician as I've stopped treating numbers and I've started treating people. In addition to that, this is what most of the scientific evidence gives us. Most of these studies, let's say in IBS or gut health, they take a person with a cluster of symptoms and then they give them a therapy. Even adrenal, right? Even many of the adrenal herbs, the vast majority of the studies do not do an adrenal test. They look at a person's symptoms and then they give them an herb. And what do you know? There's a high response rate. So somewhere along the line, lab companies inserted themselves and convinced us all that, well, you've got to know what the adrenal levels are before you give whatever it is. And well, you need to know if it's high cortisol, because if it's high cortisol, you got to give them phosphatidylserine. No, you don't. Many of these things are going to operate through improving in an adaptogenic fashion, hence adapted. And sorry, I know I'm rambling here, but adaptogens bring you back to normal, right? So it wouldn't matter if the lab was high or low, and it wouldn't matter if you have constipation or diarrhea, right? So the adaptogenic adrenal herbs bring you to center. The probiotics bring you back to normal bowel function. And it doesn't matter if you had high cortisol, low cortisol, high akkermansia, low akkermansia. The therapeutics are corrective. And so all the labs do is make you chase a lab marker, usually at the exclusion of the person right in front of you. And their symptoms and their story is really where the pearls are to help them. So sorry for my passion here, but it's I just see, and we've documented on the podcast, people who have wasted thousands of dollars, and they come in and see us, we listen to their story, and in a month or two, they're much improved. And sure, we have challenging cases like anybody else. We don't have all the answers, but boy, if we can get results and save someone thousands of dollars, that's a huge win. I just want people to be more aware of. So that's the one. And then the other thing is to have hope. These things, although they can be stressful when you're not feeling well, and as someone who hasn't felt well myself, it stinks. I hear you. I'm with you. But the solutions are usually pretty straightforward. And these things are not as bad as they are typically portrayed when you read about SIBO, hypothyroid, autoimmunity. You get a much worse narrative, in my estimation, online than actually is the case. So take a breath. Most people are really healthy. There's a monkey wrench or two in their system. If we can get rid of that, then they're going to move forward and be healthy and be just fine.
Dr. Ruscio, filled with practical, salient, and very important information today. Thank you so much. Where do we find you online if people want to learn more about you?
Thank you. It's been a pleasure. drruscio.com, druscio.com.
Listen, thanks so much for everything that you do, and I really appreciate you being on the Gut Reset Summit, and all the best with everything going forward.
Awesome. Thank you again.